welcome to Brain Chat. I'm Dr. Mitzi Joy Williams, your board-certified neurologist and fellowship-trained multiple sclerosis specialist. My mission is to engage, educate, and empower those impacted by chronic neurologic conditions to become an active part of their healthcare team. Here on Brain Chat, we'll be discussing all things brain health, wellness, self-advocacy, and how to care for your loved ones who are impacted by chronic neurologic conditions. Join me and my super friends and special guests as we get ready for the next episode. And most importantly, let's get nerdy. Hey, everybody. Welcome to another wonderful episode of Brain Chat. Thank you for joining us. I am Dr. Mitzi Joy Williams, the nerdy neurologist, and I am so excited about today's episode. Now, listen, I know I say that every 2 weeks, but for real, I'm really excited. We're talking about an issue that is really important and probably has impacted each of us in some way throughout the course of our lives, especially those of us that are getting a little bit more mature, let's say. But I'm really excited about my guest today. But before we get into it, first we want to thank our sponsor, the National MS Society, for sponsoring Brain Chat this season. And then I also want to thank each and every one of you for taking out the time to learn something and about how to advocate for yourself and for your loved ones who have chronic neurologic disease. All right, so let's get into it. I have got an amazing guest for you guys today. If you have never logged into Brain Chat, just type in the chat. Let me know where you are viewing us from. I bid you greetings from Atlanta, Georgia, and I am wrapped up in my Joy Life Foundation sweater today, representing the Joy Life Foundation, which also sponsors Brain Chat. But let's get into it. So today I have a very special guest that I have known for quite some time, working together in different capacities to help fight the health disparities. So I'm so excited to have this conversation with her today. Stephanie Monroe is the Vice President and Senior Advisor of Health Equity for Us Against Alzheimer's. It's a national advocacy group based in Washington, D.C., and she was the founding director of African Americans Against Alzheimer's, which is the first national network created specifically to respond to Alzheimer's disease's disparate impact on African Americans. She's worked nationally, locally, and through strategic partnerships. She raises awareness about the impact of Alzheimer's health disparities on communities of color and women, and the need for greater minority participation in clinical trials. A woman after my own heart. Y'all know I love talking about participation in clinical trials. She wants to help find better treatments, diagnostics, and hopefully a cure for this disease that impacts so many. She is an attorney by training with 3 decades of federal public policy experience, a former Assistant Secretary of Education for Civil Rights, and prior to serving in that position, she had a 25-year career on Capitol Hill after serving several key staff positions in the U.S. Congress, including Chief Counsel of the U.S. Senate Committee on Health, Education, Labor, and Pensions. She also serves on several boards, and she works with federal agencies and others on issues to ensure full equal opportunity to participate in and benefit from all that America has to offer. Oh my gosh. Stephanie, it is so good to see you on Brain Chat. Welcome.
I'm so pleased to be here. This is a great way for me to have an end of my day. It might be the beginning of others, but I'm just so excited to be here and talk truth.
Absolutely. Absolutely. Now, listen, you have had an amazing career in so many different spaces. Tell the Brain Chat audience how you wound up working in the neuroscience space and working in the field of dementia, particularly focused on Alzheimer's disease.
Well, it's an interesting thing. I've never actually looked for a job. They just sort of come to me. So I feel like I'm always drawn to the thing I'm supposed to do next, and then it becomes very interesting. And I actually joined my work with Alzheimer's at the launch. I went there as a public policy person just to see what was this issue. Why was Alzheimer's so important? Because frankly, I was surprised that in all my years in the Senate, no one had ever lobbied or talked to us as a committee about Alzheimer's disease. So I was like, what's going on? What's this all about? And I went to this committee, this meeting, and Sandra Day O'Connor was there speaking about her husband who had Alzheimer's, and just hearing these statistics, and I just could not understand. Why is no one talking to us about it? But as a result of the fact that people were silent about it, I think at the time when I started this work, which is like 2011, Alzheimer's funding was about $400 million a year,
Mm.
and it was costing about $7 billion a year. So
Wow.
one of my bosses
Say
said
that again for the people in the back.
$400 million a year. And at that time, I think it was costing the US about $7 billion.
Mm.
Shocking. If I was running a company,
Yeah.
as my boss would once say, and I proposed a $400 million solution to a $7 billion problem, I'd be fired. And
Right.
every other disease in America during that time, we were seeing decreases
Mm.
in the number of people and the cost and everything. And Alzheimer's was and still is receiving about a 75% increase every year.
Mm.
75% for a number of reasons. But thankfully, our investments have gone up significantly, and we're doing a lot more in terms of learning more about this disease, research about it, trying new things that work, prevention, slowing, hopefully curing, vaccines. And we can talk about
Yeah.
that another time. But
Yeah.
lots of really exciting things that we're learning. But one
Yeah.
thing remains the same, unfortunately, is what we're learning is about the people who participate. And the people
Mm.
who are participating, overwhelmingly, we're talking 95%, are white people of European descent.
Mm.
So those people who believe nothing in us without us, we're putting a lot of stuff in us that does not involve us, and it's our own fault
Right.
to a great degree, but also because we haven't demanded to be included. And that's another
Yeah.
conversation. But there's so much for us to learn. It is exciting. We're making great progress. We've got to make sure that what's coming out works for all of us.
Yeah, absolutely. And we're going to dive a little bit deeper into that because I am picking up what you are putting down, so to speak. That is speaking my language, right? The importance of inclusion and recognizing, that solutions need to involve everyone for us to really say that they're effective. But let's back it up a little bit and talk about Alzheimer's. So when people often use the terms dementia and Alzheimer's synonymously, but they're not exactly the same thing. I try to explain to people that dementia is a symptom, right? Like numbness is a symptom, but it doesn't tell you necessarily the cause of it. So when we think of dementia, we think of a constellation of different symptoms that affect the way we think. For many people, it may be short-term memory problems. For other people, they may, in some cases get lost going familiar places. Some feel like, there are tasks that they've been doing for 20 or 30 years, for instance, at their job. And then all of a sudden they have to think harder about it, or they have more trouble, or now they have to write the steps down. And so there are many different, symptoms that can be related, but all dementia is not necessarily Alzheimer's. Now, the other thing that I think is important to point out from the beginning is that dementia is not a normal part of the aging process. Now, walking into a room and forgetting where your keys are, that's a part of the aging process, right? Or sometimes walking into a room and you forget what you went in there for, and you walk out and you walk back and you got it, right? That can be part of the normal aging, but this kind of progressive worsening in your cognition to where it begins to affect your daily life, your ability to function, your finances, etc., is not normal aging. And I think another thing that's really important that I often point out to people as a neurologist is if you come into my office complaining about your memory, then a lot of times you're not the person with dementia. Usually the person with dementia comes in and somebody else is with them and they're like, I'm fine. Why am I here? And I'm like, well, why are you here? Because my daughter brought me, because my son brought me. I have no idea why I'm here, right? So often that person is not keenly aware of the severity of, the dysfunction, that's going on. So that's kind of dementia. There are many different causes of dementia. It could be, people have issues from stroke. There are other kinds of dementia. But tell us how you explain Alzheimer's, to people when you are talking in circles or advocating or talking to patient groups. Tell us how you explain that to them. What is Alzheimer's disease?
Absolutely. So I think what you've just said is 100% correct. When I'm talking to people who really don't have any idea what it is, and frankly, don't want to really talk about it because they're afraid of what that might mean for them or their loved ones. I mean, there's a lot of fear.
Yeah.
Polls show us it is the most feared disease in America, and it's actually the most costly disease in America, not because of healthcare costs, but because of unpaid caregiving costs, lost productivity, things like that. The way I
Mm.
describe dementia is like an umbrella. And then under the umbrella are specific types of dementia. Alzheimer's is about 75% of all dementias. So they say, right?
Mhm.
There aren't
I've
really
seen 60
definitive,
to 80, so you right
yes,
in the middle.
there aren't definitive diagnoses. I mean, it used to be that we could not officially diagnose Alzheimer's until autopsy, but now we
Mm,
can look at symptoms. Now we can, people could probably have heard that there are some blood tests that let us get a better idea of what is happening. And the treatments do vary.
mhm,
If you have Alzheimer's, you might get a certain type of a treatment. They might do a PET scan. They can see how it's impacting your brain in a certain area of the brain. If you have frontal
mhm,
temporal, you may have speech problems, not memory as much, but your speech. You may forget how to say words. You may be speaking, but very deliberately, but words that you think you're saying, other people are not hearing. Sounds a little bit like
mhm,
gibberish. If you have
mhm,
Lewy bodies dementia, describe that almost. It's sort of like a dementia with really some strong psychological issues that accompany that. It
mhm,
could be a lot of
mhm,
hallucinations, a lot of
mhm.
aggression, things of that nature. And then they would give you
Right.
different types of medicines to help with the aggression and maybe help with the hallucinations. Until recently, all of the medicines for the different types of dementia were symptomatic and were helpful in that way. Other type of dementias include vascular dementia, and a lot of
Mhm,
people have mixed dementia. As you mentioned, people
mhm,
with chronic conditions, heart disease, diabetes, which are all vascular types of conditions, often accompany dementia. We'll lump it, sometimes we call it Alzheimer's, sometimes we call it vascular, but we know that if people have well-controlled chronic conditions that are vascular in nature, that can sometimes improve the condition. Unfortunately, I know this disease very well because 3 years after I started working with Us Against Alzheimer's, my father was diagnosed.
mm.
And it's a journey. It was a journey
Yeah.
getting a diagnosis.
Mhm,
We had to encounter 3 different doctors before what I knew was going on was validated. There were
mm,
some who said, "Why would you want to know?" There were
mm,
some who said, "Oh, he's just aging. It's normal."
mm.
It's one thing if you forget where your keys are. It's another thing if you don't know what a key is. And
Right.
so convincing doctors that they should make the diagnosis. Recent polls show that something like, 40, 50% of doctors thought dementia-like symptoms were normal parts of
Mm,
aging.
mm.
And so we've got a lot of work to do to treat this as a disease so people will, number one, go to the doctor because you can have dementia that is reversible based on other kinds of things, right? Urinary tract infections can cause
Mhm,
dementia-like symptoms.
mhm,
Sometimes people that are taking high doses of aspirin. There are
mhm.
other physiological things that can happen. And so it's important to go to the doctor if you start feeling confused or that something's just not right.
Right.
You may not
Right.
experience this, but you may know something's just not right. I used to be able to do such and so in a short period of time. And now it's just, taking a little bit longer. Go to the doctor, make sure they do a blood workup, see
Mhm.
what's going on, make sure there's nothing that's sort of out of sorts like it should be. Thyroid can cause
Yeah,
dementia symptoms, right? So let's look
absolutely.
at what those things are that medicine or a change of your lifestyle can actually correct. And
Mhm.
don't worry. I mean, I know that's really hard to say. Don't worry because it is a disease. It's not your fault. We can catch it early. And what we're seeing now, which is really encouraging, is that we can see changes in the brain often 20 years before the first
Wow.
symptom. So
Wow.
that we can do things, and we're learning more about lifestyle changes that we can make
Mhm.
that affect all diseases, actually, but very specifically and intentionally. Things about our nutrition, hydration, exercise, smoking,
Mhm.
things like that we can take control over, that the Lancet Commission and others have shown that could reduce as much as 40% of Alzheimer's cases. So catching
Yeah.
it early, taking responsibility, going to the doctor, nothing to be ashamed of here, and doing what you need to do to get on top of it. And you will have to be an advocate, because there are people who necessarily won't want to make this diagnosis and get you the treatments that you do. It would be as if going to the doctor with a lump in your chest and someone saying, oh, it's probably a pimple. No. Let's get this thing checked, right? Let's do the mammogram. Let's go the route and make sure that what you're telling me is really true. We don't like it, but there is bias in the healthcare system. Not that people want harm, but people that don't want to do as much as they should to get communities that are underrepresented and are overrepresented in so many diseases. We're always 2, 3, 4 times as likely, African Americans are, and Latinos in particular, of getting certain diseases as others. And we have a harder time sometimes getting the right diagnosis, so we have to demand it. So it took us 3 times. I fired 2 doctors, finally found one, and now my dad is on a great course. He's 12 years in, and it's strange every day, but I can tell you right now, I've brought him, he's living with me, and he is the happiest man I know. He can't use a lot of words, but sometimes he tells you stories in complete sentences, and we don't know if it's true, false, or in between. But he is laughing. He is singing. Sometimes in the middle of the night, I have to go downstairs and sleep on my sofa because he's singing in his bed. And I love it.
Yeah.
Is it a burden?
Amazing.
But is it a joy that wherever he is, whatever he's thinking is bringing him joy? And I know I'm very lucky, because there are many people who have aggressive forms, a lot of confusion. They're just so sad and unhappy. And people that are caring for people who are in that state, they need an extra prayer and an extra, they need to be treated as a second patient when they go to the doctor. We all do.
Absolutely.
Right?
Absolutely.
So the doctor's not asking you about your mental health, and you go in, ask him, do you care about my mental health? Make sure I'm okay.
Exactly.
Right?
Exactly. Yeah. I mean, so listen, there was so much you said in that. So many things that struck me as extremely important. Let's kind of go back and let's paint the 50,000 foot view. Right. When we think about dementia, I feel like in recent decades, it's really come to the forefront because so many people are affected. You gave a statistic that is a 75% increase, in dementia cases. That, at the time that you started doing the work, $7 billion were being spent on dementia care, but there was significantly less funding for that. Give us like the 50,000 foot view. How many people, in the US are affected by dementia? Are there certain communities that are more affected than others? Give us just kind of that, give us that 50,000 foot view.
I appreciate that opportunity to overwhelm people with statistics, but
we love statistics on Brain Chat.
What is important is that know that each of these numbers represents a person. Because a lot of times especially when I worked in Congress, people would come at us with statistics, and members of Congress would not really get that these are people, like grocery store people in church, people that you walk down the street. We know that there are at least 6.7 million Americans with dementia today. At least, because we also know that certain communities are not receiving a diagnosis. And significantly, as many as 40% worldwide who are Black or African American are not receiving a diagnosis. So that number could be so much more. We just don't even know, right?
We don't even know.
The biggest predictor of Alzheimer's, or the biggest risk factor, is age. So we're blessed that we are living longer and aging. However, we're also seeing people get it younger. And a lot of African Americans and others are getting it younger. Living with it longer. People to live, but living with this disease longer, that can be a challenge, right? We know that Blacks are at least twice as likely to get Alzheimer's as non-Hispanic whites, and the Latinos are at least 1.5 times as likely. For reasons, some of which we think we know, some of which we're learning more about. That means the interventions have to be different. We also know that we don't particularly have a good record of how to reach these populations. Some people say, oh, they're hard to reach. And one of my doctor friends said, no, actually, they're just hardly reached. We have to be intentional and adopt methods of how to reach populations, not to mention language barriers, not to mention, I'm thinking linguistic barriers, but also literacy.
Right.
You cannot go into a community and talk like you are an MD.
Right.
Terms like amyloid, tau, blah, 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 blah. They're just like, what are you talking about? Right? You got to break
You
it
got to bring
down.
it down. Bring it down so that it's understandable.
Absolutely.
Right.
Again, giving people permission to talk about it and
Mm-hmm.
to not feel ashamed,
Right.
because communities view mental health as a curse.
Right.
Religiously, they view that if you're not of your right mind, you're of your wrong mind. That's because you did something wrong.
Right.
And
Not
that's
true.
dispel those myths. We've got to dispel those myths. We know that there are 11 million, at least, caregivers, people who are caring, family caregivers for people
Right.
with Alzheimer's. We don't
Mhm.
have a policy in the United States that will provide any kind of pay, replacement of income for people who are taking off full-time, part-time, or just staying at home to care for a loved one. I could
Yeah.
tell you personally, let's just go there. For the longest time, I had my parents in for about 5 or 6 years. We had them in first independent living and then assisted living.
Mhm.
And the independent living, which has no reimbursement, Medicare does not cover this, was $8,000 a month.
A month.
Yeah.
Wowzers.
And then when we put them in assisted living, where they actually had caregivers who would pop by, it was $12,000 a month.
Mm-mm-mm-mm.
I just
That's a
moved, and
lot.
it's regional. I just moved my aunt, who has Alzheimer's with Lewy bodies, to our area where all of our family is on the East Coast. She was paying $12,000 a month for she and her husband to stay at an assisted living facility. That does
Mm.
not take care of dementia patients.
It does not.
On top of that, get ready, and they happen to have enough wealth to do this, $40,000 a month.
A month.
She had to have 24/7 care. When I
Wow.
saw the checkbook, I was like,
Wowzers.
what would
A
people do?
month.
People end up leaving people alone who shouldn't be alone. They end up putting
Yes.
them in places where they shouldn't be, right? They end
Absolutely.
up, just not being able to provide good care.
Yeah.
And there are so many stories about what happens. It's not good for the caregiver because they're under stress. It's
Mm-mm.
not good for the patients and their health. We don't have a policy in this United States that has a long-term care policy.
Mm.
It's you're
Mm.
on your own. And
Basically, and it's so interesting you said that. So my grandmother suffered from dementia and she passed away in COVID in 2020. She was 94 years old and she was relatively in her right mind until maybe the last 5 years where we really had
Mhm.
trouble. And my mother, who fortunately was retired, took care of her full time, and just those challenges, the toll, eventually when she needed someone there all the time, we have to hire someone to come over so my mother could go to the grocery store, and God
Mhm.
forbid my mother was going out of town, there's so many things that people don't take into account, that need to be done. And especially when someone needs 24-hour care, if they're on Medicare, that doesn't cover, a
Right.
sitter. If you're on Medicaid, it does. But if you're on Medicare, it doesn't
Yeah.
cover someone to come and help you, unless you have a nursing need like an
Mhm.
IV or, and eventually we were able to put her on hospice where we did have better coverage. But again, one of the challenges is that many people, or, a fair number of people with dementia, are actually otherwise healthy. Some of them are
Exactly.
otherwise healthy. They have minimal medical problems. And I always say, fortunately or unfortunately, my grandmother wasn't very ambulatory. So she couldn't walk. So by the end, when she was having hallucinations, it was bad, but it was good that she couldn't walk because she might be outside the house wandering around. You know what I mean? And so there's so many challenges that are not taken into account, and we do not have good coverage, for insurance for these people,
Right.
and for relief for their caregivers so that people can be in a safe environment. And that
And pay
definitely
leave.
needs
It's
to
like
change.
we found out during COVID how important it was for people to be at the bedside.
Yeah.
When my dad is in the hospital, I need to be present for a lot of reasons
Yeah.
to advocate
Mhm.
for him to make sure, that they're giving him what they should be giving him, that there's no medication, because there's, a lot of times when you go in the hospital doctor is not communicating with the primary care doctor. We've got a
Mhm.
system that
Mhm.
has so many different challenges.
Yeah.
It's a great system, but we really you need to be present, either
Yeah.
physically present or make sure that that staff knows you're going to show up. You're not going to just like dump and run. Same thing with
Yeah.
parents or your loved ones are in out of home placement. You've got to show up. I can't tell you how many, and it was so sad to go to one of these places and see people who, like, every time I have a comment, they're like, "You're the best daughter. I haven't seen my daughter in 2 years." And I'm like, "What?"
Mm. Mm.
You know, our
Yeah.
we don't have, we just need to have a better culture that respects the elderly. We do a
Mhm.
fairly good job of providing parents what they need when they have a baby, tax credits, some childcare vouchers and things like that. But when you age, it's a different thing. Other cultures
It
do it very
is.
that you could lose your job for taking off time to take your parent to the emergency room because they're old is shameful. And we are
It
the
really
only
is.
industrialized nation in the world that does
Mm.
not have a national paid and family leave policy.
Mm.
So we need to work better. We need to work better at this.
Mm.
We spend more, I think, than most every other nation, and we do have some of the sickest people in our country. So we've
Absolutely.
got to do better. And as we continue to
Yeah.
go down and age, I mean, we are already almost a 50-50 country. We're like
Mhm.
59%, 47% non-white.
Mhm.
We have got to do better at reaching
Yeah.
everyone with what they need. Equality gives
Yeah.
everyone the same thing.
Mhm.
We don't need equality. We need
We don't.
equity, giving everyone
Mhm.
what they need to do better. And we have the ability to do that. And in fact, it would save the government money.
Yeah.
If we prevent Alzheimer's using that 40%, we would save a ton of money and we would
Mhm.
save the other cost that caregivers are bearing. And we just have to be very
Yeah.
intentional about it. Very intentional
Yeah.
to create a healthcare system, not just a sick care system, which is what we have now.
Mm. Yeah, I love that. So let's circle back to diagnosis. So you shared a little bit about the challenges you had with your father's diagnosis. As a neurologist, sometimes I'm on the opposite end where people just come to me and it's like dementia, and I'm like, "Well, who said you had dementia?" My primary care. Okay, well, did they do any testing? No, they just put down dementia. And I'm like, okay, well, what kind of dementia, And so I get a lot of people who just have a label of dementia, but there's no specificity of what it's from. It's just put everybody on, some of the symptom management, put everybody on Aricept, they got dementia, whatever. And so then we're trying to backtrack and figure out what is the cause, and of course, some of the therapies that are, now coming to the forefront are best given when people have very mild symptoms.
Mhm.
So how can loved ones advocate for them, for their family members, or what are some of those things that people can be looking out for to tell them, okay, we probably need to get this checked out and not wait until this gets worse? What are some things that you would suggest to
Well,
our audience, to those care partners?
great question. First thing, people are entitled. I don't like to use that word, but I'm going to use it here. When they
Mm.
turn 65, and if they were able to go on to Medicare, they are entitled to receive a welcome to Medicare visit that does include a brain health screening.
Mm.
A couple of different ways that they would be screened by these tools that have been validated by science to be able to show where you are. Are you experiencing normal brain changes, or is there something that we need to look deeper at?
Mhm.
And if your doctor doesn't offer that to you, you need to ask for that to happen. If he says
Mm.
he can't do it or doesn't have time, he has to make time. That's one of his agreements in terms of being able to get reimbursement from the federal government for Medicare, is that they do this annual wellness exam that includes that. So that's step
Mhm.
one. And
Okay.
a lot of people that get diagnosed are getting diagnosed 10 years, like 75, age 75 or older
Yeah.
sometimes. But we do
Yeah.
have people as young as 26 years old that have been diagnosed with Alzheimer's.
Mm.
So for different
Wow.
reasons, um,
Mm.
you're entitled to that at that moment. People need to
Yeah.
remember to ask the doctor for a checkup from the neck up, We're good at
Okay.
treating people from here down, but we need to do a checkup of the brain. The brain is the engine of the entire body. If it's not working
Absolutely.
to regulate everything, your thyroid, your endocrines, I don't know all the words because I'm not a doctor, but I play one on TV
Mhm.
sometimes. Um, you know, to diagnose and to treat all of those things that are important for our body. If the brain isn't working right, you can have things again that look like dementia that need to be treated like dementia in some cases, but
Right.
are reversible.
Right.
And they can cause serious things. So that's the first thing. So ask for it. And if you can't get it, maybe look for another doctor because there are doctors out there. You don't have to necessarily go to a specialist initially.
Mhm. Right.
Generally, if you think that you've got something wrong, they will try to send you to a neurologist. Unfortunately, a lot of people in the country don't have access to neurologists. People in rural America,
Right.
people in some urban centers, they
Mhm.
don't have access to gynecologists because we do have a healthcare profession shortage, unfortunately.
Absolutely.
So you may have to travel a little bit.
Mhm.
Some of these things can be done, frankly, online, right? You can
Mhm.
do a virtual visit. And I think we're getting better at that. And there are brain tests. I think it's Alzheimer's has something called the Brain Guide. And
Mhm.
you can take this test. It's on your phone or on your computer. It's not going to diagnose you, but it'll give you an idea of how you're doing. And then you get a printout that you can actually take to the doctor to have a
Mhm.
conversation. Hey,
Yeah.
this is this validated tool. This is what it's saying I'm doing. What do you think about this? And engage them
Yeah.
in that conversation. So we do have to sort of take charge because sometimes
Mhm.
we're busy. I absolutely understand that. Some doctors only have like 15 minutes. My doctor, because he knows I'm going to come in with a lot of chatter and it's going to be an hour. So you know it's going to happen. When she comes in there, I'm going to get everything in. And I actually write notes.
Yes.
It's like when you go to the hospital, when you go to get your car done and you go in there and everything that you thought was wrong with the car is all of a sudden got healed before you went to the door.
Mhm.
Remember the things that were bothering you and just put it on a notepad so that you can remember, ask
Absolutely.
this question and you can control part of that narrative of
Yeah.
what's happening at the
Yeah.
doctor.
Yeah, and I'm very much an advocate for preparing for your doctor's visits. I say the two things that, you know, give me some of the most anxiety as a doctor is when we've gone through a visit, you say everything's okay. I've got my hand on the knob and you're like, "Did you know that I forgot where I was yesterday and I, fell off a cliff?" And I'm like, "What?" I
Oh
thought
my,
we were done. It's like,
yeah.
so writing those things down helps us to get to what's important early on. Um, and then the second thing is if you say, my memory's bad, and I'm like, okay, well, what did you forget? Okay, well, what kind of things are happening? Or I ask someone if they have a pain and they don't know where it is or how it hurts or how often, So thinking about those things and prioritizing what's going on before you go to a doctor is extremely important. And having that care partner with you, the one that is most connected, is also extremely important. If they can't be there, guess what? Their phones, there's FaceTime. There are many ways for us to connect. And so, when I get someone in the office and I'm like, "Why are you here?" They're like, "Because my daughter's," and I'm like, "Well, where's your daughter?" She's not here. Well, let's call her on the phone and let's see if
Right.
we can make sure we can get to the bottom of it. So, thinking of those different ways to get connected. If you can't make it to that visit with your loved one in person,
Mhm.
having them call you or FaceTime you so you can participate. I have people send lists of questions with
Mhm.
their loved ones, so there are many ways that we can be intentional about making sure that those visits are well used and that the issues that we're having are actually being addressed. So I love
That
that
is so,
you talked about that prep.
that's so great. I mean, you're an excellent doctor. I'd come to you.
Yeah. Well, I do my best, but I'm like, listen, man, don't let me get my hand on that knob and you tell me you fell off a cliff yesterday. Now write it down so we can get to the cliff first, before we start talking about where you went on vacation, because that's not the most important thing. The cliff is the most important thing. All right.
Absolutely.
So we've talked about a lot. A couple more things I want to touch on. What resources? So tell us about Us Against Alzheimer's and tell us about resources that that may be available to those who are caring for others with dementia? That's often a big issue is, where do I find resources? Where do I find information? How do I get plugged in? Is there a support community? What are some places that people can look for that? And of course, tell us about, the organization that you're affiliated with.
Sure. Us Against Alzheimer's, we are sort of in it to end it.
Mm.
We've been working for the last 13, 14 years to find better treatments and cures for Alzheimer's. We've been focusing on health equity as a priority, and have tried to create tools like the braingod.org, .com, that people can use that to get more information to empower them to go to their doctor and begin to lead that conversation. You can go to our website, usagainstalzheimers.org. There's a whole resource list of things that you can look at if you want to read more about it. The Alzheimer's Association is available in many communities, and they often have small groups that meet in churches with sororities and fraternities, and for people to talk who want to do that. Some people, they want to go it alone. And if you feel like you need to do that with your family circle, you can do that. But if you're a person who needs that kind of group support to share information and strategies and where you go for caregiving help, and maybe grants are available locally, they're there to do that more community-based support. Also, the area agencies on aging in every community, they sometimes can help you find information about like transportation. That's one of the things we've recently discovered is how I'm having a challenge with my dad's mobility. How do I safely get him from my house to the doctor? I don't want to cause an injury with him, right? Going to the doctor, getting in and out of the vehicle. They can help you find where there are places. Some places have partnered with Uber that'll provide transportation. Even the hospitals, if you get there, frankly, I found out that if you're there for 4 days, you get a lot of opportunities to have help come in. Home health care will come in after you have a certain stay if you need it. Physical therapy, occupational therapy to help with movement. Make sure you are, getting your loved one bathed correctly, that they come in and evaluate if there are tripping hazards in your rooms, things like that. And of course, Google, the wonder of all. Looking at things about where are the tripping hazards. And I think that's really important. Falls for older people, so important. You got Alzheimer's, you're falling, you're hitting your head, right? That's not good. Brain bleeds, not good for anyone, anytime. So remove those beautiful area rugs. That was one of the simplest things that people told me. Remove those rugs. Even on top,
for someone to trip over.
You will trip over those things. Make sure your shoes are fitted correctly, right? Put people in shoes with the backs that are out because they don't get that support as they start to have. So all of these, there's so many different parts of the medical community that work together to identify things that we can do that are sort of easy things that we can do in our communities to help make them safe. And when you see hazards, right, and you will, as you just walk around your neighborhood, walk down the street and just see, is this street really wheelchair accessible? If I had a wheelchair, how many bumps do I have to go over to get here? How do I get up on a curve if I'm going into my doctor's office? How many times do you have to go around the whole block of the doctor's office to figure out how to get up on the curve? We purchased a ramp for my dad to come in and out. Sometimes we have him in his walker, but going upstairs, always a challenge. You want to make sure you're holding on. So just think logically, like go around your house with an eyes view like you did if you had kids. Like where are the sockets? You get down, like I was always told, get on the floor and look around and see what's there. And I think some of that we just need to do for our people. And then look for different ways. Bathroom safety is so important. I was so blessed when I brought my both my mom and my dad came in. My mom passed literally 10 days after I brought her in. But it was wonderful to have her here. But I was able to, we used hospice and they were great in terms of coming in and identifying things that we needed and what kind of medical equipment would be helpful for us here for them. Shower chairs. I found a company because I had to put grab bars and they weren't that expensive. I called this tile company, and they said that they had a like aging friendly policy, and that if I bought the grab bars, they would install them for free.
Mm,
Right? I was like, somebody's doing something for free. That is so wonderful. There are people like that you may have to ask. Do they
right.
have any age friendly, and there they know. I can't give their name. I wouldn't do that. But
Right.
people that are out there. And
Right.
then, when you need something, ask. This is so hard for me and so many people. You want to think that you, as a caregiver, you can go it alone, right?
Right.
Don't be surprised if you are the only one in your family who sees.
Mm-hmm.
It usually comes down, unfortunately, to one person who's going to be the primary person.
Mm-hmm.
And sometimes other family members who will be volunteers when it's convenient. But you need to ask what you need. You need a vacation?
Right.
That's a need. I need you to come in and sit with my dad or take dad into your house for a week and a half because I'm going on a vacation for my mental health and because, frankly, I deserve it. I'm doing that. Healthcare, self-care
Right.
is so important. We tend to only think about self-care to the extent that it enables us to care for other people.
Mm-hmm.
But we have to take care of ourselves because we are valuable as people. We have so
Absolutely.
much to do beyond caregiving, and we need to do that. And that's what our parents and our loved ones would want us to do. So ask for help. I've seen neighbors that have unbelievably been helpful to me, bringing me meals, coming
Mm-hmm.
in, sitting with my dad. I've been able to call them in for emergency care. Whereas before it would be embarrassing, but they came and asked me, let me know.
Right.
That says, let me know if you need anything. I'm like, okay, I'm writing your name down. What's your number?
Right. I'm gonna hold you to that. Yeah.
Don't say it being cute, but we need to ask for what we need. And when people offer stuff for us, accept it. It's
Absolutely.
humbling. It's humbling. But if somebody's going to the store and they say, hey, do you want me to pick up anything for you? And you need it,
Mm-hmm.
do it. Absolutely
Yeah.
do it.
Yeah. Yeah. I think so many important things that you said there. But that asking for help is huge because
Yeah.
often we do feel like we should be able to do it ourselves. Sometimes in our community, what goes on in the house stays in the house. We don't put our business out there, all those things. But, that self-care, what I
Mhm.
often say is that many times what we consider self-care is recovery, right? So we are burnt out, burnt down to the ground, and then we do something to just get us back up to normal instead of pouring in that tank while it's got something in it so that we're a little bit above normal. But a lot of times when we talk about self-care, we're to the point where we're about to,
Yeah.
burst, and we've got to do something just to get us, back to some level
Get
of
us to the
normalcy.
50% level. Women should be
Yeah,
actually in that overflow if we can do it.
absolutely.
We absolutely should
Absolutely.
try to do that.
Absolutely.
Um,
Absolutely. So our time, if you will believe it, Stephanie, we're gonna have to do a part two. But our time is getting close to an end. There's so many nuggets here, so many amazing resources that you've talked about. I always like to ask everybody before they leave Brain Chat, what are you excited about? Working in the medical field, particularly in dealing with dementia. I deal very commonly with MS. I do have some dementia patients. Sometimes it can be hard. You hear so many stories, you hear many hardships, you hear about many health disparities, things that we need to address and continue to fight for. But at the same time, there also is usually something exciting where we're like, man, this is going to be a game changer. Tell me what that thing is for you or those
well,
things.
I'm not a nerdy neurologist, but I'm definitely a little bit of a geekwad myself. I am excited about our ability to take action on data.
Mm,
Big data that is coming out is really giving us insight into what is happening down to a zip code level. We can
mm,
predict people's health down to a zip code level, sometimes even in the neighborhood or the street. And if we have the will, we can target those particular communities that are having struggles with very much specificity. I'm very excited about data. I'm very excited about some aspects of AI
mm,
that I think can be helpful, not replace, but can help us identify and react to areas where there are, things that we could respond. Medical disasters. We talk about
mm.
FEMA responding to natural disasters. We have medical disasters that are happening in this country, and we can identify them. And it's uncomfortable, but we need to do it.
Yeah.
We need to get these things under control. The fact that we're telling people eat healthy, and then there are places where you go and literally, even in Los Angeles, right outside of Hollywood, you can go to the grocery store and all the vegetables are rotting.
Right.
They are rotting. You have to go like into Beverly Hills. Hopefully you have a car.
Right.
There's no reason in this country where that should be happening, right? We need to have more community involvement. You know, a lot of communities, frankly, churches have taken a back seat to things that they traditionally did because they felt that now the government's doing it, we don't have to. That's completely wrong. We've got to get back into seeing what's going on in our neighborhood, meeting our needs. I've got collard greens and broccoli growing in a pot. I don't know what's going to happen. The collard greens look pretty good. I might actually harvest those. But just being able to take a little pot and you can grow some things in. You know, I was so embarrassed years ago. I remember when my daughter was very young and I was cutting up a romaine lettuce head. And she was like, "What is that, Mommy? What is that?" And I'm like, "It's lettuce." She goes, "Where's the bag?" We do the fast. We get the romaine lettuce right in the bag, the salad bag. She never knew that that's what it looked like. So I definitely grow some lettuces, right?
Yeah.
Organically, just in your yard. So there are things that we can do, I think, that are exciting that we learn. You know, we've learned about communities can experience community gardens, I think are exciting. Learning about super agers, people who are living to be 100 and whatever, no kinds of dementia.
Right.
You know, tap dancing, staying active, or with dementia, like my dad, and just being happy and loving life and being there and being a joy, right? Just taking it all in. I'm excited about a lot of things, I guess.
Yes, I love it. Listen, I'm excited. You know, and I think that's so important because, you know, I really feel like for the first time in a I won't say for the first time in a long time, but you know, some of the parallels with dementia, you know, are a little bit similar to some of the ones we have with MS. Although with MS, we've had a lot of treatments that have come out at a relatively rapid pace. I do feel like that there's progress being made. And I feel like that data that you're talking about, looking at different populations and who's more disparately affected, you know, will really make a difference in how we can affect care for everybody. So I am right there along with you. I cannot wait to hear the updates the next time we see each other in person. And I just want to extend my heartfelt gratitude for you sharing your wealth of knowledge and your personal experience, which is not always easy, with us here on Brain Chat. And I look forward to our next conversation. Thank you so much. And thank you to our audience for tuning in. And I'm sure that everyone will get a lot out of this episode. And tell us again the website of your organization so that people can look up the resources and do that brain guide.
Yeah, it's thebrainguide.org or US Against Alzheimer's.
Okay, perfect. Thank you so much, Stephanie. And we'll see you guys again in 2 weeks.